You know, hip pain is one of those things that so many people deal with. And one of the go-to treatments is a simple corticosteroid injection. But what happens when that routine procedure leads to something life-altering? Today, we're going to dive into a case report that shines a light on the hidden risks behind this really common treatment.
So, this whole story starts with a situation that I'm sure millions of people can relate to. We have a 75-year-old woman. She's active, but she's just dealing with this nagging, persistent hip pain. And she did exactly what you or I would probably do. She went to her doctor to find a solution. And this timeline, wow, it really shows the entire roller coaster she went on. It starts out pretty standard, a diagnosis. But it quickly escalates to multiple injections, a catastrophic bone collapse, a whole series of complex surgeries, including a failed implant, and then finally, this incredibly long road to recovery. So how on earth did a search for simple pain relief lead to all of this? Let's break it down. Okay, so let's start at the very beginning. We'll look at the initial diagnosis and the conventional treatment path that was chosen to try and solve her hip pain. All right, so diving into the specifics, the patient was diagnosed with two super common conditions, bursitis, which is basically just inflammation, and some early wear and tear osteoarthritis. Now, it's also worth pointing out her history of osteoporosis and Ehlers-Danlos syndrome, which can affect the body's connective tissues. When physical therapy didn't quite cut it, the next logical step was corticosteroid injections. And here we go. This is the turning point. This is where a seemingly successful, totally routine procedure takes a completely unexpected and, frankly, devastating turn. At first, everything seemed to be going just fine. The injections worked. For 2 whole months, her symptoms got better, giving her exactly the kind of short-term relief the treatment is supposed to provide. This initial success is exactly what makes the next part of this story so jarring. So after her pain came back, she got a second set of injections. But this time, the result was completely different. This quote from the case report, "It's the moment everything changed." Instead of relief, she was hit with severe pain. And that was a clear signal that something had gone terribly, terribly wrong. An MRI revealed the just catastrophic diagnosis behind her pain. Her left femoral head, that's the ball part of the hip's ball and socket joint, had completely collapsed. The bone tissue had literally died. And even worse, there were signs that the same thing was starting to happen in her right hip, too. So this brings us to the core medical issue here. The patient was diagnosed with something called osteonecrosis of the femoral head, or you'll see it as ONFH. Let's just take a minute to understand what that actually is. Okay, so the crucial point here is that osteonecrosis is literally bone death. It happens when the blood supply to a section of bone gets cut off. Without blood, that bone tissue just dies, it weakens, and eventually it collapses under the body's own weight, completely destroying the joint. And while it's a rare complication from these injections, ONFH isn't some tiny, insignificant condition overall. We're talking tens of thousands of new cases diagnosed in the US every single year. And surprisingly, it mostly affects younger adults, folks between 20 and 40. Now, it's important to know there are 2 main types of this. Most cases are what you call traumatic, and they're caused by a clear injury, like a hip fracture that messes up the blood flow. But this patient, she developed the atraumatic form, which is linked to risk factors throughout the whole body, not just one single injury. And when we look at the major risk factors for that atraumatic type, what do you know? Corticosteroid use is right at the top of the list. And while scientists don't know the exact mechanism, a really strong link has been established, which brings us right back to our patient's injections. So, with a diagnosis of osteonecrosis in both hips, this patient was now facing a long and incredibly challenging road to recovery, one filled with major surgeries and some really unexpected setbacks. Let's just walk through her surgical journey. First, a total hip replacement on the collapsed left side. Then, just 2 months later, another one on her right side. And initially, everything looked good. But 10 months in, after a fall, there was another devastating discovery. The left implant had failed. This meant she had to go back for a much more complex revision surgery to fix it. And this is the key question, right? A modern hip replacement is a pretty robust piece of engineering. So why would it fail in less than a year? The answer, it turns out, lies in just how severe the underlying condition really was. The problem was that the bone death, the osteonecrosis, wasn't just in the femoral head. It had actually extended down into the femur itself.
something the surgeons just couldn't fully see during that first surgery. So this weakened bone couldn't properly bond with the implant. It's a complication called aseptic loosening, and it's ultimately what led to the failure. This patient's whole harrowing journey really forces us to step back and look at the bigger picture. It raises some really serious questions about the risk versus reward calculation for one of the most common treatments for hip pain out there.
Okay, let's look at this data because it's pretty eye-opening. A big review found that while these injections work well at first, 75% of patients feel better at 1 month, that effect just drops off a cliff. By 3 months, only a quarter of patients still feel any relief, and by a year, it's less than 10%. It's a very, very temporary solution.
So when you lay it all out like this, the trade-off becomes a lot clearer. The benefit is some short-term, temporary relief. The risks? Well, they include common minor stuff, but they also include these rare but major complications, like a serious infection, or as we saw in this case, osteonecrosis. Not to be clear, getting osteonecrosis after an injection is rare. The source material puts the number at about 2.4%. But, and this is the crucial point, when it does happen, the consequences aren't minor. They are, as this case so powerfully shows, absolutely life-altering. And this all leads to the really stark conclusion from the authors of the case report. Their final word on these injections, the full name is intra-articular corticosteroid injections, isn't just a summary, it's a challenge. Given the very limited, very temporary benefits and the potential for these catastrophic, albeit rare, complications, should this incredibly common procedure be used so routinely? It's a question that this patient's story really forces all of us to consider.